The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to this edition of the Healthcare Labyrinth Podcast, where we navigate the maze of healthcare policy and economics each week. My name is Marc Ryan, and thanks to everyone for listening in. Today, we're talking about one of the most persistent and frankly misleading narratives in healthcare policy today. The idea that Medicare Advantage is overpaid, inefficient, and somehow undermining the Medicare program itself with a lack of value and outcomes. If you follow the headlines, you've heard it. That Medicare Advantage costs too much, that plans are gaming the system, that the program only works because it enrolls healthier people. And the critics say it doesn't really deliver value or quality. But here's the problem. That story doesn't hold up when you actually look at the evidence. And that's what we're doing today, cutting through the noise and looking at the full picture, because this debate matters. Medicare Advantage now covers more than half of all Medicare beneficiaries, and the direction we take here will shape healthcare for millions of seniors to come. We'll take our usual 3 breaks to make this easier to digest. So let's start with the central claim from the critics: overpayment. That is part 1. Critics like MedPAC argue that Medicare Advantage plans are paid more than traditional fee-for-service Medicare, but that conclusion depends heavily on one assumption: favorable selection, the idea that healthier people disproportionately enroll in Medicare Advantage. But when you look at who actually enrolls in Medicare Advantage today, that assumption starts to fall apart. MA serves a more diverse and often more vulnerable population, including lower-income seniors, dual-eligible beneficiaries, and individuals facing significant social determinants of health. These are not low-cost populations, and that alone raises serious questions about the idea propagated by MedPAC that MA is just skimming healthier patients. Now layer on top of that issue the issue of risk adjustment. Critics argue plans overcode diagnoses to increase payments. But what often gets ignored is that policy has already evolved. The newer V28 risk adjustment model has reduced incentives for aggressive coding, and CMS has taken action, most notably by restricting diagnoses that aren't tied to actual medical encounters. That was a change that was just announced with the 27 rate announcement. So the version of Medicare Advantage critics often describe is increasingly outdated. And when you move past those assumptions and start looking at outcomes and costs, the narrative begins to shift rather dramatically. We will talk about that after our first break, so we'll be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We're talking about Medicare Advantage and taking all the noise out by pushing back on claims that MA does not deliver value or quality and is overpaid. So let's get to part 2, value, cost, and care delivery. Let's move from theory to results here. because at the end of the day, what matters is whether Medicare Advantage delivers better value for both taxpayers and beneficiaries. And the data here is hard to ignore. A Milliman analysis found that Medicare Advantage delivers about $185 per member per month in additional value, totaling nearly $60 billion annually. Even more important, government spending on MA was about 4% lower than traditional Medicare. That's right. It's not the overpayments MedPAC talks about, but it's 4% lower according to Milliman. That directly, again, contradicts the idea that MA is driving excess costs. At the same time, beneficiaries saw a 29% lower out-of-pocket costs compared to those in fee-for-service Medicare. So we have lower government spending, lower beneficiary costs, and additional value delivered. That's not what overpayment looks like. That's what efficiency looks like. And a big reason for that efficiency is how care is delivered. Medicare Advantage isn't just paying for services, it's actually managing care. A Humana analysis highlights this clearly. MA members in value-based care arrangements saw 24.3% fewer inpatient admissions, a reduction of roughly 229,000 hospital stays, and about $12.8 billion in savings. Even within Medicare Advantage, value-based arrangements outperform non-value-based ones. That tells you something important. This isn't just about the program, it's about the model of care. MA enables preventative care, care coordination, chronic disease management. Traditional Medicare, by contrast, largely pays after the fact. So when critics compare the two programs, they're not comparing equals. They're comparing a modern coordinated care model to a legacy transactional payment system. With that, we will take our second break, and when we return, we will tackle critic MedPAC's usual narrative. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We're talking about Medicare Advantage and taking all the noise away from the critics by pushing back on claims that MA does not deliver value or quality and is overpaid. So part 3, breaking down the MedPAC narrative. MedPAC had 2 arguments on overpayment. The first, risk adjustment overcoding. But even MedPAC analyses are now recognizing that if overcoding occurred, numerous reforms from CMS have basically taken all that part of the overpayment narrative away. Those changes include the V28 risk model, as well as more recent proposals to get rid of unlinked chart reviews when encounters are not accompanying them. But so let's take a closer look at the remaining argument that drives most of the criticism from MedPAC right now, favorable selection. Because if that argument doesn't hold, the overpayment narrative starts to collapse. A study from Harvard Medical School in Inovalon directly tests the MedPAC assumptions on favorable selection. It found that Medicare Advantage enrollees were only modestly less sick, about 10% lower risk scores than fee-for-service beneficiaries before enrolling. And once you control for real-world factors, demographics, geography, and social risks, the story changes even more. That same body of research shows 11% higher total costs in fee-for-service Medicare, significantly higher utilization in fee-for-service, 52% more emergency visits, 40% more admissions, 30% more inpatient days, 126% more readmissions, and 71% more preventable hospitalizations. That's not selection, that's performance. Medicare Advantage is managing care in a way that reduces avoidable utilization. Now let's talk about MedPAC's analysis specifically. An FTI consulting review identified several major flaws in terms of MedPAC's look at favorable selection. It had an over-reliance on beneficiaries who switch programs, exclusion of key populations like ESRD patients, failure to account for dual eligible and special needs plan members, and ignoring plan bids and cost comparisons. These are not minor issues. They fundamentally shape the conclusions MedPAC reached, which I've just told you are just wrong. If you exclude more complex patients or fail to properly account for them, you can create the illusion that MA is benefiting from favorable selection. So when MedPAC and others claim large overpayments, it's worth asking, are they measuring reality or constructing it? Because the full evidence increasingly points in a different direction. With that, we will take our last break, and when we return, we will tackle bringing it all together and concluding. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back to the Healthcare Labyrinth Podcast. I am Marc Ryan. We're talking about Medicare Advantage and taking the wind out of the sails of critics by pushing back on claims that MA does not deliver value or quality and is overpaid. So part 4, the full picture, patients and system savings. Now let's bring this all together because this is where the case for Medicare Advantage becomes the strongest. Start with the most important question. What are seniors actually experiencing? Well, an analysis from ATI Advisory and the Better Medicare Alliance found that Medicare Advantage beneficiaries in 2021 spent $2,541 less per year on premiums and out-of-pocket costs compared with those in fee-for-service Medicare. That's about 40% lower total spending. And that gap didn't shrink, it grew. Using 2022 data, ATI and Better Medicare Alliance found that MA enrollees spent $3,486 less on average, or about 46% lower costs compared to those in fee-for-service. That's a meaningful difference for any senior, but it becomes even more important for those with higher needs and those with modest incomes. For beneficiaries with 3 or more chronic conditions, Medicare Advantage enrollees spent $4,120 less than comparable patients in traditional Medicare. That's the key point. The sickest patients in the system are seeing the largest financial benefit from being in Medicare Advantage. In fact, those same patients in fee-for-service Medicare are spending nearly double what similar patients spend in MA. As I often say, the Medicare Advantage program is the single greatest social safety net program in America today. All of this directly contradicts the idea that Medicare Advantage underserves complex patients. If anything, it's providing more protection where it matters the most. Now, step back and look at the system as a whole. The Elevance Public Policy Institute analyzed what happens as Medicare Advantage enrollment increases, and the findings are consistent. Higher MA penetration is associated with lower total Medicare spending per capita, and I mean not just in MA, but in the Medicare program in toto. Specifically, a 10-point increase in MA enrollment leads to about a 1.5% reduction in spending in Medicare total. Estimated savings from 2012 to 2021 because of this is $111 billion, or about $83 billion after adjusting for coding and intensity. And in updated estimates, up to $144 billion in total savings occurs. That's not a marginal impact. That's a structural improvement in how Medicare operates. So when critics argue that Medicare Advantage is draining the program, they're missing or ignoring the broader impact, because the data show that as MA grows, beneficiaries pay less, utilization becomes more efficient, and total Medicare spending trends lower. That's not what a failing program looks like. That's what progress looks like. Medicare Advantage is aligning incentives, managing care, and delivering value in ways traditional Medicare has struggled to replicate. Is it perfect? No, and I'm the first to admit it. But the claim that it's fundamentally broken or massively overpaid simply doesn't match the evidence, and these academic opponents are clearly making up their data and reporting falsehoods. If anything, it's pointing toward the future of Medicare. That's it for today's episode. Thanks for listening to the Healthcare Labyrinth podcast. If you enjoyed today's episode, be sure to subscribe and share it with colleagues interested in healthcare policy. Until next time, stay curious, stay skeptical, and keep navigating the healthcare labyrinth with me. We will find our way out together. Again, I am Marc Ryan. This is the Healthcare Labyrinth Podcast. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.